Open your medicine cabinet right now. Go ahead, I will wait. Look at that row of vitamin bottles. The calcium supplements your doctor told you to take for your bones. The vitamin D pills you started after reading an article online. The multivitamin you have been swallowing every morning for the last 20 years because someone told you it was insurance for your health. Now let me tell you something that is going to shock you. 3 of the most commonly taken vitamins and supplements in the world are not protecting your health. They are secretly, silently, relentlessly clogging your arteries. They are accelerating the very cardiovascular disease you are trying to prevent. And by the time you finish watching this video, you are going to look at those bottles very differently. I am not some anti-supplement extremist. I am not here to tell you that all vitamins are useless or dangerous. Many supplements have legitimate, evidence-based uses when taken properly, in the right doses, by the right people. But the supplement industry is a multi-billion-dollar machine that profits from your fear of deficiency and your desire to be healthy. And much of what they sell you is not just unnecessary. Some of it is actively harmful to your cardiovascular system. Today I am going to tell you exactly which 3 supplements are doing the damage, why the science shows they are dangerous for your arteries, and what you should be doing instead. Let us get straight into it. Dangerous supplement number 1, calcium supplements. This is going to upset a lot of people, especially women over 50 who have been told for decades to take calcium supplements to prevent osteoporosis. And look, I understand the logic. Your bones need calcium. As you age, your bones lose calcium and become brittle. Osteoporosis leads to fractures. Fractures in elderly people can be devastating, even fatal. So taking extra calcium in pill form seems like a no-brainer, right? Just give the bones what they need. But here is what nobody told you about calcium supplements. The calcium in those pills does not just go straight to your bones. It floods into your bloodstream all at once, creating a sudden, dramatic spike in blood calcium levels that your body was never designed to handle. When you eat calcium-rich foods like dairy products, leafy greens, or sardines, the calcium is released slowly during digestion over a period of hours. Your body absorbs it gradually and has time to direct it where it needs to go, primarily to your bones and teeth. But when you swallow a 500 or 1,000 milligram calcium supplement, that massive dose hits your bloodstream within 30 to 60 minutes. Your blood calcium levels skyrockets far above what food would ever produce. And here is the devastating cardiovascular consequence. When blood calcium levels spike above what your body can immediately use and process, the excess calcium has to go somewhere. And one of the places it goes is into the walls of your arteries. It deposits itself in the arterial lining, in the smooth muscle cells of your blood vessel walls, and in existing atherosclerotic plaques. This process is called vascular calcification, and it is one of the most dangerous things that can happen to your cardiovascular system. Calcified arteries are stiff arteries. They lose their elasticity, their ability to expand and contract with each heartbeat, their ability to accommodate changes in blood flow and blood pressure. Stiff, calcified arteries lead directly to systolic hypertension, the type of high blood pressure where the top number is elevated, which is the most common form of hypertension in older adults. They increase the workload on your heart because your heart has to pump harder to push blood through rigid pipes instead of flexible, elastic vessels. They dramatically increase your risk of heart attack because calcified plaques are more likely to rupture, which triggers blood clots that block blood flow to the heart muscle. And they increase your risk of stroke through the same mechanism in the blood vessels that supply your brain. The research on this is extensive and deeply concerning. Multiple large-scale studies involving tens of thousands of participants followed over many years have found that people who take calcium supplements have a significantly increased risk of heart attack compared to people who get their calcium from food alone. One landmark meta-analysis that pooled data from multiple randomized controlled trials found that calcium supplementation was associated with approximately a 30% increased risk of myocardial infarction, which is a heart attack. 30%. That is not a trivial increase. That is a substantial elevation in your risk of having the single most common cause of death in the developed world. And the cruel irony is that the evidence supporting calcium supplements for bone health is actually much weaker than most people believe. Several large studies have found that calcium supplements provide little to no reduction in fracture risk in the general population of older adults. The bones do not efficiently absorb and utilize the calcium from supplements the way they do from food sources. So you are taking a supplement that may not even be helping your bones while it is simultaneously calcifying your arteries and increasing your risk of a heart attack. The solution is clear. Get your calcium from food, not pills. Dairy products like yogurt, cheese, and milk are excellent sources. Canned sardines and salmon with bones provide highly absorbable calcium. Leafy greens like broccoli, bok choy, and collard greens, which notably are low in the oxalates that I have warned about in previous videos, are good plant-based sources. Fortified foods like certain orange juices and plant milks can fill gaps. Aim for 1,000 to 1,200 milligrams of calcium per day from dietary sources, and you will give your bones what they need without flooding your bloodstream with artery-clogging calcium spikes. Dangerous supplement number 2, high-dose vitamin D supplements. Now this one is going to be controversial because vitamin D has been treated as a miracle supplement for the past decade. It seems like every other health article recommends taking vitamin D for everything from bone health to immune function to mood to cancer prevention. And vitamin D deficiency is genuinely common, especially in older adults, people who live in northern climates, people with darker skin, and people who spend most of their time indoors. So supplementing with reasonable doses when you are actually deficient makes medical sense. But here is the problem. Millions of people are taking mega doses of vitamin D, 5,000, 10,000, even 50,000 international units per day or per week, without medical supervision, without blood testing, and without understanding what excess vitamin D does inside their body. And what it does is directly connected to the first supplement I just discussed. Because one of vitamin D's primary functions in the body is to increase calcium absorption from your digestive tract. Vitamin D tells your intestines to absorb more calcium from the food you eat. Under normal circumstances, this is a good thing. It helps maintain adequate calcium levels for bone health and other critical functions. But when you take high doses of vitamin D, you supercharge this calcium absorption mechanism. Your intestines start absorbing far more calcium than your body needs or can safely handle. Your blood calcium levels rise, sometimes significantly above the normal range, a condition called hypercalcemia. And what happens when you have excess calcium floating around in your bloodstream? The exact same thing I just described. It deposits in your arteries, it accelerates vascular calcification, it stiffens your blood vessels, it promotes plaque formation, it increases your risk of heart attack and stroke. And the combination of calcium supplements plus high-dose vitamin D is particularly devastating. You are flooding your system with extra calcium from the supplement while simultaneously turbocharging your body's ability to absorb even more calcium through the vitamin D. It is a double hit that dramatically accelerates arterial calcification. Some researchers have described this combination as a recipe for cardiovascular disaster in older adults. Furthermore, excess vitamin D and the resulting hypercalcemia can directly damage your kidneys. The excess calcium that your kidneys have to filter out can form calcium deposits within the kidney tissue itself, a condition called nephrocalcinosis, which gradually destroys kidney function. And as I have discussed in previous videos, declining kidney function is itself a major risk factor for cardiovascular disease, creating a vicious cycle of organ damage. The research on high-dose vitamin D supplementation and cardiovascular outcomes has been disappointing for those who hoped it would be a miracle heart protector. Multiple large randomized controlled trials, including the massive VITAL trial involving over 25,000 participants, found that vitamin D supplementation did not reduce the risk of heart attack, stroke, or cardiovascular death in the general population. In other words, taking vitamin D supplements for heart protection does not work. And when taken in excessive doses, it may actually increase cardiovascular risk through the calcification mechanism I just described. The solution is nuanced and requires a personalized approach. First, get your vitamin D level tested with a simple blood test before you start supplementing. If your level is genuinely low, below 30 nanograms per milliliter, supplementation at a reasonable dose, typically 1,000 to 2,000 international units per day, is appropriate under your doctor's guidance. Second, get retested after 3 to 4 months to make sure your level has come up to the normal range and is not going too high. The target is a blood level between 30 and 50 nanograms per milliliter. There is no evidence that pushing your levels higher than 50 provides any additional benefit, and it increases the risk of hypercalcemia and vascular calcification. Third, do not take vitamin D megadoses without medical supervision. 5,000 or 10,000 units per day is not appropriate for most people and carries real risks. Fourth, try to get as much vitamin D as possible from natural sources. Regular safe sun exposure, About 10 to 15 minutes of midday sun on your arms and face several times per week stimulates natural vitamin D production in your skin. Fatty fish like salmon, mackerel, and sardines are excellent dietary sources. Egg yolks, mushrooms exposed to UV light, and fortified foods also contribute. Dangerous supplement number 3. Synthetic folic acid in high doses. This one flies completely under the radar, and almost nobody is talking about it. Folic acid is the synthetic form of folate, which is vitamin B9. It is found in virtually every multivitamin on the market. It is added to enriched flour, bread, pasta, cereal, and dozens of other processed foods as part of government-mandated fortification programs. And for pregnant women, adequate folic acid intake is absolutely critical for preventing devastating neural tube birth defects in developing babies. That public health recommendation is sound and has prevented enormous suffering. But here is what most people do not realize. If you are not a woman planning to become pregnant, taking additional folic acid on top of all the folic acid already in your fortified foods may be doing significant harm to your cardiovascular system. The problem centers on a genetic variation that affects approximately 30 to 40% of the population, though the severity varies by ethnicity. This variation involves an enzyme called MTHFR, methylenitetrahydrofolate reductase, which is responsible for converting folic acid into its active, usable form called methylfolate. If you have certain common variations in the gene that codes for this enzyme, your body has a reduced ability to process synthetic folic acid efficiently. The unconverted folic acid accumulates in your bloodstream, and this excess unmetabolized folic acid has been associated in research with increased inflammation, impaired immune function, and potentially increased cardiovascular risk. But even beyond the MTHFR issue, the connection between excessive folic acid supplementation and cardiovascular disease involves a molecule called homocysteine. Homocysteine is an amino acid that is naturally produced in your body during the metabolism of another amino acid called methionine. Under normal circumstances, homocysteine is recycled back into methionine or converted into other useful molecules with the help of B vitamins, including folate, vitamin B6, and vitamin B12. When this recycling process works properly, homocysteine levels stay low, but when folic acid supplementation is excessive, or when the synthetic form cannot be properly converted to its active form, the homocysteine recycling pathway can become paradoxically disrupted. Elevated homocysteine is a well-established independent risk factor for cardiovascular disease. It damages the endothelial lining of your arteries, promotes oxidative stress, accelerates atherosclerotic plaque formation, increases blood clotting tendency, and stiffens blood vessel walls. Essentially, elevated homocysteine attacks your cardiovascular system from multiple directions simultaneously. Multiple large clinical trials attempted to test whether lowering homocysteine with folic acid supplementation would reduce heart attacks and strokes. The results were consistently negative and sometimes concerning. Supplementation with folic acid and other B vitamins to lower homocysteine did not reduce cardiovascular events in the studies, and some trials showed trends toward increased risk in the supplemented groups. This suggests that the synthetic folic acid itself may be causing problems that offset any benefit from lowering homocysteine levels. There is also emerging research suggesting that excess synthetic folic acid may promote the growth of existing precancerous and cancerous cells, accelerate the progression of atherosclerotic plaques by providing fuel for rapidly dividing cells within plaque tissue, and mask vitamin B12 deficiency, which is extremely common in older adults and itself causes neurological damage and cardiovascular problems. The solution is straightforward. First, if you are not a woman of childbearing age who is planning or could become pregnant, you almost certainly do not need supplemental folic acid. You are already getting substantial amounts from fortified foods in your diet. Second, if you do want to ensure adequate folate intake, get it from natural food sources rather than synthetic supplements. Dark leafy greens, legumes like lentils and black beans, asparagus, avocado, broccoli, and citrus fruits are all excellent sources of natural folate, which your body handles much more efficiently and safely than synthetic folic acid. Third, if you choose to supplement, look for methylfolate, also labeled as L-methylfolate or 5-MTHF, which is the already activated form that bypasses the MTHFR conversion step and does not result in unmetabolized folic acid accumulating in your blood. Fourth, ask your doctor to check your homocysteine level and your B12 level, especially if you are over 60. These simple blood tests can reveal problems that are easily correctable before they cause cardiovascular damage. Now let me connect all three of these supplements together because there is a critical underlying lesson here that applies to every supplement you will ever consider taking. The supplement industry has created a dangerous cultural belief that more is always better, that if a little vitamin D is good, a lot must be amazing, that if calcium is important for bones, taking huge calcium supplements must make your bones invincible, that if folic acid prevents birth defects, everyone should take it in large quantities forever. This belief is not just wrong, it is deadly. Your body is not a simple machine where you can just pour in more raw materials and get better output. It is an incredibly complex, tightly regulated biological system where every nutrient, every mineral, every vitamin exists in a delicate balance with everything else. When you artificially spike one nutrient to extreme levels through supplementation, you disrupt that balance. You overwhelm the systems designed to process that nutrient. You create byproducts and consequences that your body cannot handle. And the result, more often than people realize, is damage to the very organs you were trying to protect. The greatest protection for your cardiovascular system does not come from a bottle. It comes from eating a varied whole food diet rich in fruits, vegetables, whole grains, lean proteins, nuts, seeds, and healthy fats. It comes from regular physical activity. It comes from maintaining a healthy weight. It comes from managing stress. It comes from getting adequate sleep. And it comes from working with your doctor to identify and address any genuine deficiencies through targeted, evidence-based supplementation at appropriate doses. Here is what I want you to do right now. Step 1. Look at every supplement you are currently taking. Write them all down, including the doses. Be thorough. Step 2. For each supplement, ask yourself a critical question. Was this recommended by my doctor based on a blood test showing I was actually deficient? Or did I start taking it because I read something online, or a friend recommended it, or I saw an advertisement? If it was not prescribed based on documented deficiency, question whether you should be taking it. Step 3. Bring your complete supplement list to your next doctor's appointment and ask for a thorough review. Ask about interactions with your medications. Ask about appropriate doses. Ask for blood tests to check your calcium, vitamin D, B12, and homocysteine levels. Make decisions based on data, not fear or marketing. Step 4. Shift your focus from supplements to food. Challenge yourself this week to get your calcium from yogurt instead of a pill, to get your vitamin D from 10 minutes of sunshine instead of a capsule, to get your folate from a big salad instead of a tablet. Your body knows how to process nutrients from food. It has been doing it for millions of years of human evolution. It does not know what to do with a concentrated pharmaceutical-grade bolus of synthetic nutrients that arrives in your bloodstream all at once. Step 5. Share this video with everyone you know who takes supplements, which is practically everyone over 50, because the supplement industry spends billions of dollars every year convincing people that they need more pills, and someone needs to provide the other side of the story, the side backed by large-scale clinical trials instead of marketing budgets. Your arteries are the highways of your body. They carry life-giving blood to every organ, every tissue, every cell. When those highways get calcified, stiffened, and clogged, everything downstream suffers. Your heart, your brain, your kidneys, your eyes, your limbs, everything. And the tragic irony is that for millions of people, the very pills they take each morning to protect their health are the ones gradually turning those flexible, elastic highways into brittle, calcified pipes. You deserve to know the truth. Now you do. What you do with it is up to you. Type in the comments which of these 3 supplements you are currently taking. Calcium, vitamin D, or a multivitamin with folic acid, I want to know. And type Arteries if this video made you rethink your supplement routine. Subscribe and hit the notification bell. I will keep bringing you the truth your supplement bottles will never tell you. I will see you in the next video. Protect your arteries. They are the lifelines of everything you are.